Let's start our study with a description of the hierarchy or organization of living things. Everything starts on the chemical level. So molecules make up everything that is in the universe, atoms and elements and things like that. So we start on the chemical level. Like, maybe there might be a chemical that has a bunch of carbons in it, or this right here would be like a phospholipid. So we have these chemicals that form into molecules, and then these are organized into cells. So then we get to, actually I'll go like this, we get to the cellular level. And cells are the smallest unit of structure and function in living things. So we can make a cell. Actually, why don't we make a fun cell that you could put some dendrites on it. So cells have all kinds of shapes. Can you believe this is just one little neuron? So let's say, for example, that that's a neuron, okay? And so the chemicals, the molecules make up cells. And then many cells working together make up a tissue. So that's going to be the next one we go to, is the tissue level. So many cells working together make up a tissue. And the tissue level is, let's say, like a nerve, for example. It might be a nerve that's carrying the information from many neurons. So cells make up tissues. So chemicals make up cells, cells make up tissues, and then the tissues make up organs. So we'll go to the organ level. So see how it's just getting more and more complex? And the organ, in this case, maybe it would be the brain. And then that organ works together with several other organs to make up a whole organ system. And the organ system might include the brain and the spinal cord, let's say, and all the nerves in the body. That would be the nervous system. Could have the brain, the spinal cord, and all the nerves that come off of it. How about if I do it like that? So then many organ systems make up the whole organism, and that's going to be the highest level. That's you or me. So to go through it again, you've got the chemicals that form into molecules, and they make up cells. And then many cells working together, they make up a tissue. You can have 4 different kinds of tissue in the body. All the tissues in your body are either, like the one that I used as this example, nervous tissue, or they can be connective tissue, like fat or blood, or they can be muscle tissue that helps you to move because it can contract and shorten, or they can be epithelial, which this kind of tissue, it lines all the insides and outsides of your body. Like your skin is epithelial tissue. So these tissues, maybe a little bit of nervous, a little bit of connective, a little bit of muscle, a little bit of epithelial, work together then to make up one organ. In my little example, it is the brain. and then several organs working together, let's say the brain, the spinal cord, and all of the nerves, they make up a whole organ system, and then the organ systems make up the organism. And there are 11 organ systems that are typically described in an anatomy and physiology class, and we're going to go through all of those in our anatomy and physiology course. The 11 body systems of a typical anatomy and physiology textbook and how it's organized. So I'm going to draw a person. Okay, so here's our person, and we're going to start with the brain. And then there's a spinal cord too. And these make up the nervous system. We're going to need a lot of room on here, so I'm going to put it up higher. So we'll go number 1. I'll keep track of them. And then that way when you practice them, you'll have them numbered. So the nervous system includes the brain and the spinal cord. And I'm going to put this in yellow. So it includes the brain and the spinal cord. And its function is communication and control. Okay, next, let's look at the skin. Let's see. The skin, which we call the integumentary, that means your covering, your coat. And it includes, let's see, I'm trying to get an orange here. What happened to that orange I was using? I guess it was that one. Okay. So the integumentary system includes your skin, your hair, your nails, and then the sweat glands of your skin and your oil glands. And its job is protection and also sensation, right? Helps you have sense of feeling. It also makes vitamin D. And next, let's do a muscle, right? We've got muscles all throughout our body. Why do we need muscles? We need muscles so that we can move. So this is the muscular system. In a healthcare setting, a lot of times they call this the musculoskeletal system, and they teach them together because, of course, if you have that they often go together for patients, whether they have like some sort of a mobility problem or weakness or atrophy. So the muscular system includes all of your muscles. Don't you like how loud my kids are when they get up? So all the muscles, it keeps doing that. All the muscles, and its job is movement, but also you'll find a lot of times that anatomy classes will expect you to know that the contraction of these muscles helps to generate heat to keep you warm. Okay, now let's look at a bone. Maybe we can put like your femur right here. So this bone represents the skeletal system. Like I said, these are often taught together, muscular and skeletal. But in a traditional anatomy class, they're not. A lot of times for students wanting to go into nursing, but once you get into a nursing program, then they'll talk about them all together. They'll talk about the bones and the muscles together. So these are going to be all your bones and joints. And the job of the skeletal system, not surprising, is, support and movement, aids in movement, and also it makes all your blood cells. All your red blood cells, all your white blood cells. Okay, let's see if we can fit one more onto this side. I could put reproductive since we're down near the bottom. So let's see, what color am I going to use now? Purple. So the reproductive organs are generally in this genital region right here. And of course, it depends on if you're a male or a female. But the reproductive system is going to include, for males, the testes, and for females, the ovaries, and the uterus, and the penis, and for females, the vagina. So these are, and of course the purpose of this is to make more humans, right? Make more people. Okay, so now we're going to move to the other side of this body, and we'll go ahead. I kind of like, to work my way down. Kind of makes sense that way. So for number 6, let's go ahead and do the cardiovascular system. So I'll make the heart right here. And put number 6, cardiovascular. And maybe you never knew this, but cardio means heart, and vascular means vessels. So this system includes, actually I'm going to put that in orange because that's what it includes, is the heart and the vessels, and I'm using orange for that. So you've got the heart and vessels, which is literally what it means. And its job is to transport substances all around the body, whether it's transporting nutrients or waste, carrying those away, or hormones. Let's put a little arrow on here. Okay, and then why don't we put next to that lungs. So there's a lung right here, and then there's a lung right here, and then there's also a trachea and then bronchi that separate. So we'll put that for number 7, and this is going to be the respiratory system. And it includes, as you can see, the lungs, trachea, bronchi, and its job is gas exchange. So it gets oxygen inside of you and carbon dioxide out. Also helps a lot with pH of the blood, balances the pH of the blood. I think that I'm going to talk about the urinary system next because it makes a lot of sense to talk about that one, because your urinary system also helps with balancing your pH. So these systems work together to do that. So let's put some kidneys on this guy or gal. And those are the organs included are going to be the kidneys, the ureters, the bladder, the urethra. And the job of the kidneys is to balance water in the body, pH in the body, electrolytes in the body, and to filter out waste. And then those, of course, exit the body as urine. Oh, I didn't put an arrow on here, so that's the urinary system. Oops. Like that. Okay, then we come to number 9. Why don't we do the endocrine system? So I can put a little dunce cap on top of these, and then you have a little bow tie one called the thyroid gland in your neck, and pituitary gland hangs down from your brain. So we'll go number 9, endocrine system. And it includes a variety of endocrine organs, such as the thyroid, the adrenal, the pancreas, the pituitary. I'll just put etc. because there's others too. And the job of the endocrine system is pretty much the same as the nervous system. It's communication and control. It just does it slower using hormones instead of nerve signals. So I'll put via hormones. Okay, why don't we go number 10, digestive system. And if you take a nursing class, they'll usually call this the gastrointestinal. That's going to be like your stomach and then all of your intestines. And then I'll put etc. And it's going to deliver nutrients to your cells. It's going to break down the food and then get the nutrients into your bloodstream. And then that just leaves us with one more, the immune system. And that includes all your white blood cells, as well as lymph organs. So white blood cells and lymph organs. So the white blood cells are able to travel around the body and go fight where they need to fight. And in fact, that's their job then, is to fight disease and protect you from getting sick. On this page, we're going to talk about regional terms. And these, again, for healthcare workers are going to be very important when describing injury locations or places that hurt and that sort of thing. Let's start with the head. So first of all, anything that has to do with the head is called cephalic. I'm going to zoom in a little bit here. Cephalic. This means head. And then specifically when you're talking about the skull itself, then we would call it the cranium. Or cranial. And that is referring to the skull. And then the back of the head is called the occipital region. And that's actually the name of a bone on the back too. So this is specifically the back of the head. Then when we look at the face itself, the front part of the face, I'm going to actually switch colors here. Let's see. The forehead is called the frontal region. And the eyes, anything having around the eyes is called the ocular region. The ears are called the otic region. And the mouth, this one I'm sure you're familiar with, is the oral region. That's mouth. The chin is called the mental region. And I don't know how it got that name, because that doesn't make a lot of sense, does it? The cheeks are called the buccal region. I'll put that over here, buccal. Those are things doing with the cheeks. Let's see if we can get an arrow to go all the way from buccal to the cheek. This region right here is called the cervical region because it has to do with the neck. And then the vertebral region has to do with where the rest of the vertebrae are. This is where the spine is, or the rest of the spine, I guess I should say. And then that lower part of the back is called the lumbar region. Lower back. And then below that, you have the sacral region, which is the very bottom, of the spine, referring to the bottom where there is a bone called the sacrum. Okay, so gluteal region. Those are the buttocks. Limb, so we call it a lower limb. And this first part right here is called the thigh. And this part right here is called the sural region. And this is the basically what you would call your calf or the back of your lower leg. And then there's a little region right here, that little bend at the back of your knee, that's called the popliteal region. you can take a pulse there on people if they have, like, let's say a lot of head trauma or other problems from a something, maybe a car accident. You can get their pulse in that popliteal region. Okay, and then the back of the foot is called the plantar region. Maybe you've heard of plantar fasciitis. This is the thigh or the femoral region. So thigh and leg, like that. So the front of the leg is called the crural region. So that's the front. And the calf, so this one would be the back. So crural and sural are opposite to each other. You see that? Now the foot in general is just called the pedal region, like a pedestrian, right? But the big toe has a special name called the hallux. Where the kneecap is, that is the patellar region. And the hips are called the coxal region, because that's what your hip bone is called. Oh, and the patellar then is the kneecap. And pedal just means foot, and hallux is the big toe. This region right here is the shoulder, and it's called the acromial region. It means shoulder. And then there's the armpit. That's the axial region. The upper arm is called the brachial region. Maybe I can do that over here. So above the elbow, that's brachial, which means arm. And then maybe then it also makes sense that the lower arm then is called antebrachial, because ante means before. So before the upper arm is the antebrachial. So this is basically the forearm, what you would call your forearm. A neat little section right here that's called the antecubital region. And this is an important healthcare landmark because it's where most people have their blood drawn from. So this is the front of the forearm. Now the hand has a name, like the foot's called pedal region. The hand we call the manual region. Like if something is manual, it means you're doing it with your hands, right? And then just like the foot, the thumb has a special name. So the big digit, right? And that is going to be called the pollex. But all of the fingers are called digits, or the digital region. So the pollex is a special name for the thumb. The digit are the fingers, and also the toes. The palmar region right here refers to the palm. It's kind of analogous to the plantar region that we talked about on the bottom of the foot. This upper part, it's everything above the diaphragm actually, but then there's also a central part called the sternal region where your sternum is. So it's the middle would be the sternum, then the whole area would be thoracic. And then you've got your abdominal region, which is below the diaphragm. And when it's the area that is protected down within the, like your hip bones, then we call it the pelvic region. The groin, so like where your legs meet your torso, that's called inguinal. The inguinal region, that's your groin. The pelvic region is just above that. And then the very bottom is going to be the pubic region, where the pubic region of the hip bone is. Directional terms. These are important for healthcare workers when they're trying to describe the location of an injury or where they need to do a surgery, etc. So I'm going to show you these by drawing a couple of people in a couple of different positions. The anatomical position is when the person is facing forward and they have their palms facing forward too. And they're standing upright. So that's what we call the anatomical position. So this person that I'm drawing right here would be in the anatomical position. Maybe I better write that here. So anatomical position. They're upright and their palms are facing forward. Okay, now let's talk about some terminology. There are 5 sets of terms that are all opposite to each other that I want you to learn. The first one is superior and inferior. So if the structure you're talking about is lower than the other structure, then you would say it's inferior. So like your foot is inferior to your head. It's lower down. So that's pair number 1. Now the second pair, I'm going to have to draw the person standing sideways like this. Now, the second pairing I want you to think about is if the structure is more toward the back of the body or more toward the front of the body. So pair number 2 is toward the front or toward the back of the body. If it's toward the back of the body, we say it's posterior. You might also see the word dorsal used, and that's fine too. If it's toward the front of the body, we use the word anterior, and you might also see the word ventral used. So that's word pairing number 2. The third pairing that I would like to look at is over here, and it has to do with limbs. So, here is a limb, right? And notice that the foot is a farther distance from the torso than the top of it. So the part that is farther away, we say is distal to the torso. And the part that, the hip in this case, that's the closest to the torso is called proximal. So you can do this on an arm. So like your elbow is proximal to your fingers, but your shoulder is proximal to your elbow. So we could talk about it like that on the limbs. Okay, then that will be our third pairing. Our fourth pairing has to do with whether the part of the structure is closer to the midline of the body or farther away. So the closer it is to the midline, we say the more medial it is. So medial. And then the farther away it is, we say it's lateral. So that's our fourth pairing, are the terms medial and lateral. And then the fifth pairing, what's a color I haven't used? I guess I could use yellow, is superficial and deep. So as you go deeper into an organ, Then we say deep, and as you go more toward the surface, you would say superficial. So let's say they were doing a brain surgery and they had to take a tumor out that was deep versus one that maybe skin cancer right on the surface that would be superficial. And this could be in any organ. So the closer to the surface it is, the more superficial, and then the deeper in, the deeper it is. And then over here, I've added a couple of terms, supine, do you see this over here? And prone. These refer to which way the body is laying. So a body that is laying on its back, looking up at the pine trees, that's how I always remember it, supine, laying on your back. And prone is when you're face down. So these positions are often told to healthcare workers as important positions for patients to be kept in, let's say if they have pneumonia or maybe recovery from a surgery. We're going to talk about planes and sections. These are important for healthcare workers when they're thinking about imaging in particular, looking at x-rays, looking at MRIs, looking at CAT scans. If something is divided, whether it's, let's say the organ is a heart or a brain, if it's divided into two sides, like a right side and a left side, then we say that that is a sagittal section. So let me just draw this person here real quick. So if this person is divided into a right side and a left side, we call it a sagittal section. Similarly, with if an organ is divided like that. So that's pairing number 1 for sections. So sagittal section is going to divide the structure or the organ and then if it's right down the middle, it's called mid-sagittal, which kind of makes sense, right? Right down the middle. And if it's a little bit off to the side, though, we call it parasagittal. Parasagittal. And that would be like if the section were off to the side, like this. And again, I'm using like a whole person here, but it could just be one little organ. Okay, now let's look at another kind of section. This kind of section is when something is divided into a top and a bottom. And it is going to be called a transverse or a cross section. So this would be a transverse section. So if it's the whole body, like I've done here, but it also could be the heart, let's say, or the brain, where they're taking sections when they do an MRI to look at the various parts of it. So number 2 is a transverse or a cross section. And it divides the structure into a top and a bottom. Okay, now let's look at a third kind of section, which is going to divide something into a front and a back. So with this one, we could put our person like this from the side. Put that nose on there so you can tell. Now this section is going to divide something into a front and a back. And again, it could be the heart, right? So like an MRI could look at the heart from the front and with a slice so that you're looking at the front of it or the back of it. So this is our third kind of section. It's called a frontal Sometimes you'll see it called a coronal section, especially if they're just looking at the head. And this is going to divide the structure into a front and a back. So these are actually really easy to remember the differences because they all have the same letter for the section as to the way they divide it. A frontal section divides it into a front and a back. A transverse section divides it into a top and a bottom. And a sagittal section divides it into two sides. The human body is organized into cavities, brain and the spinal cord. So this is the posterior body cavity. And so it includes the brain and the spinal cord. And then the posterior body cavity is actually divided up into two. You've got one is the cranial cavity. Remember that meant skull, right? And then inside that skull is the brain. And then the other one it's divided into is the vertebral cavity, and that's where your spinal cord is. Then the front of your body has the anterior body cavity, and it is also divided up into smaller cavities, and we're going to look at that more closely. But this top one is the thoracic cavity, and then the bottom one is called the abdominopelvic cavity. There's an important separation point between the two that separates them, and that is a muscle called the diaphragm. And that's going to be important in this next picture too. And they are separated, like I said, by that important skeletal muscle called the diaphragm. So let's go ahead and just label that on here to make sure we understand that that's the separation point. And then the thoracic cavity is made up of smaller cavities, ones that house the lungs. These are the pleural cavities. So I'm going to say the thoracic cavity has three smaller cavities. One is the pleural cavity. There's really two of those, right? Because you have two lungs. The thoracic cavity then consists of the pleural cavities, and then a smaller cavity between those called the mediastinum. The mediastinum is a smaller cavity between the two pleural cavities, and it contains the heart and the trachea and the esophagus and all of those large blood vessels that come off of the heart. So it's this area right here. This is called the mediastinum, this cavity in between. And then within the mediastinum is yet another cavity called the pericardial cavity. And that's where the heart is going to be. So that's the pericardial cavity. So you see how it's like cavities within cavities. Now when we look at the abdomen, you've got the whole thing is the abdominopelvic cavity, but the upper portion is just called the abdominal cavity. And then the lower part that's protected by your hip bones is called the pelvic cavity. The abdominal regions have different names, and these are, once again, important for healthcare workers as they are charting and acknowledging where different injuries and hurts are. So let's go ahead and show you there are two ways that the abdominal pelvic cavity is typically split up. And this first way I'm showing you is more common in healthcare settings. You're going to see this sort of thing in charts. You've got the right upper quadrant, and that's just abbreviated RUQ. Then you've got the left upper quadrant, and that is abbreviated LUQ. Makes sense, right? Can you guess now where we're going? This is going to be the right lower quadrant, or RLQ, and the left lower quadrant. And remember, we always use the perspective of the patient, and that's why the right is on the opposite of your body, because imagine you're looking at the patient laying on the table. Now, so that means like if someone's gallbladder hurts, it would be in their right upper quadrant. Right up here is where their liver is. Or if it were down here in the right lower quadrant, that's could be appendicitis. The left lower quadrant, they might have diverticulitis. Now I'm going to show you another way to split up the different sections. And this time, though, we're going to divide it into 9 instead of 4. So I'm going to have a top, a middle, and a bottom. And then I'm going to have a right and a middle and a left. So see how we're going to end up having 9 quadrants. I'm going to need a smaller pen for this one. Let me just make this a little smaller. So let's start in the middle where the belly button is. And this is the umbilical region. Above that is upon the stomach, so it's called epigastric because that means upon the stomach. And then underneath the umbilical region, then we call that one the hypogastric because it's under the stomach. Hypo means under. To the right and left of the umbilical region is the lumbar. So you've got the left lumbar, because this would be on par with your lower back, the left lumbar region, and the right lumbar region. So if someone hurts their back, then it might be charted as they're complaining of right lumbar region pain. Okay, then your pelvis has a portion of it called the ilium. And so this is called the right iliac region because it's right over that part of the pelvis. And then the left iliac region. The funniest named ones are the hypochondriac region. So the right hypochondriac region and the left hypochondriac. And these get their name because hypo means under and chondro means cartilage. And so these regions are right under your rib cage. So they're right under the cartilage of the rib cage. And if you have heard that word hypochondriac, you know that that's someone that thinks that they're sick all the time, right? Well, apparently this came from ancient Greece understanding of medicine, where they believed that if you had something wrong with your liver, which is over in this area, or maybe your spleen, which is more in this area, then you would feel anxiety. And one of those manifestations of the anxiety would be worrying that there's something wrong with you all the time. And then over time, now it's morphed into a hypochondriac as someone that just always thinks there's something wrong with them. These body cavities that I've been talking about all have protective membranes on them. And I want to show you a little bit about this. The one key concept I want you to know is that these are what are called serous membranes. And they serve an important job in reducing friction when your heart beats, when your lungs inflate, and when your intestines move food through. So that's really one of their key roles. So let's go ahead and look first at the heart. So right here we have the heart. I'm going to outline it in red. And then we're going to take a close-up look right here at this little section. And actually what I'll do is I'll color the heart a little bit more through here, okay? So you get the idea. Here's the heart. And then let's put this again so you can see. So then we're going to take a look at the wall, okay? And then let's take that red again. So this is basically the heart itself, right? Well, the thing is there's a membrane right on the heart. And that membrane is called the visceral pericardium. See that? And so it would be going all the way around the heart. And of course, on the front part of it too, you can't see that. It's harder for me to show you in a drawing, but it would be encircling the whole thing. Okay, then there is a second wall. And why don't we make that one purple? And you can see that right here. And this is going to be called the parietal pericardium. And if you were looking over here, you would kind of have it. So these are membranes. And when you dissect a heart, you can see these membranes. It's like the heart is held within a sac. And then in between those two layers is a very thin layer of serous fluid. Now, I'm showing it kind of big right here, but that's just to get the idea across. But really, it would be very thin layer that just helps to reduce friction as that heart beats. Now, if someone gets pericarditis, such can happen after an infection or after some vaccines, then you can have inflammation of this pericardium, and that's when it's going to restrict the movement of the heart. It can actually lead to a heart attack. So let's put some labels on here. So this first one, I think I'll do it and put a dot right here. That is the visceral pericardium. Visceral pericardium. That word pericardium means around the heart, and visceral means internal organs. And this means around the heart. And then the parietal pericardium, put a dot right here. Actually, let's do the fluid first so that you don't run out of room. This is the serous fluid that reduces friction. And it might be called pericardial fluid, would be another name for it. And then in purple, let's do the third layer. Oh, I guess I needed black first, sorry. This is the parietal pericardium. That word parietal means outer wall. So this is going to be the outer layer. Okay, so that's the way all serous membranes are. They all have the important job of reducing friction. That's why they're so important to us. And they always have an inner layer called the visceral layer and an outer layer called the parietal layer. So let's look at the lungs and see this same pattern. So the lungs, we could make them kind of in here, right? So let's do, this is the actual lung tissue. But all of the lung tissue is going to be covered and surrounded by a serous membrane. So that's the lung itself. And then we'll use the same color. So we'll use green for the inner layer. And that's going to be called the visceral pleura. Now, I do wish that it was just called like pulmonary or something that's a little easier for you to know, but pleural always means lungs. And we can put a label on here that this is then the visceral pleura. And then why don't we add the serous fluid? That would be the next layer out. And this is going to help reduce friction when you take big inhales. Serous fluid. Let's label that. Oops, should do it in blue, right? Serous fluid. And then the outer layer we'll put in purple, and that will be the parietal pleura. It's that outer layer. And again, it would be all around the front and surrounding it. It's a little hard to do it in a drawing like this, but hopefully you get the idea that the entire lung is encased with this, or most of it anyway. But it's not just on the sides like you see in a picture like this. And this is the parietal. And so if someone gets an inflammation here, they call it pleurisy or pleuritis. Okay, now let's look last at the intestines, and we'll make the intestines themselves maybe like a kind of that. I don't know what color that is. This color though. Oops. So here are the intestines. Could put that there too. Intestines. And remember then that we're going to have, it's going to be covered and surrounded with a thin membrane called the visceral peritoneum. And this is going to help every time your intestines roil and move, then they need to have some level of friction reduction. So this is the visceral peritoneum. And hopefully you're with me and understand that the next layer is going to be the fluid that's in between, and it is the serous fluid. And it's what does the job of reducing the friction. So that's the serous fluid. And then outside of all that, in purple, we'll do the parietal peritoneum. So you see how they all have a similar naming? The inner layer that's on the actual intestines is visceral because it's the internal part. And then the outer word means wall, so we can call it parietal. The parietal peritoneum. If someone gets peritonitis, then they get an inflammation here, maybe an intestine burst, and a little bit of fecal matter from the colon gets into that membrane, and it can cause inflammation. So we can have different kinds of inflammation. We can have the, I guess I haven't really used like a bright orange. So we can have peritonitis. Whenever you see itis on the end of something, that means inflammation, and that will come up over and over again in this class. If it's in the lungs, we would call it pleurisy. Sometimes you'll see it called pleuritis, and that's an inflammation of the pleural cavity. And I should put over here that these are the lungs, right? And then pericarditis is what we call it when the inflammation is in the heart. And that inflammation makes it so that the fluid isn't doing its job. So there's that itis again. And this is probably kind of obvious, but this is the heart, right? Let's talk about feedback mechanisms because they're very important in anatomy and physiology. They maintain what's called homeostasis, which is the balance in your body. If you have a homeostatic imbalance, you're going to be sick or not feeling good or not able to maintain your body in all of its different systems. So maintain homeostatic balance, I'll put here. Now, the most common kind of feedback that we see is negative. And that means that if you have too much of something, then the response is to bring it down. So negative feedback is by far the most common. And I'm going to give you an example of how this would work. So let's say you always have to have a stimulus, okay? And the stimulus, let's say, is that you are cold. Okay? Now, you would never know about that unless you had receptors for it. So you need to have a way to sense what that is. And we call those parts of our bodies receptors. They're oftentimes a nervous system, regulated by the nervous system, but not always. And so example here would be a skin temperature receptor, which we do have. Now it notices it, and then it fires an action potential and sends the information about you being too cold to the control center, which in this case is going to be your brain. And oftentimes it's the brain, not always though. And then the brain responds with a command on how to handle the situation. And it tells what's called an effector, which is usually a muscle or a gland. So like if you're too cold, you might start shivering, or you might get up and walk around. And so that effector is going to bring, in this case, it will bring the temperature up. So return the muscle action, effector action, returns temp to where it should be. So this is our most classic kind of feedback that we're going to see in the body. Now, if I were going to go through this once again, so I'm going to add a couple of things. So the stimulus is noticed by a receptor. You've got to have that. So if you're deaf, you're not going to be able to notice sound stimuli, right? And then you're not going to be able to do anything about it. If there's something loud near you, you won't know to move away, that it could be dangerous. So then the receptors alert the control center, and then the control center commands the effector what it should do. Commands the response by the effector. And then the effector is able to carry out that response because maybe it's a muscle or something. So this is going to be your classic feedback mechanism. I do want to mention positive feedback, just because I love these examples. Positive feedback works differently. Positive feedback would be when a stimulus actually causes more of an action that causes more of the stimulus. So I'll give you a couple examples. So the positive feedback example, I'll give you this for a stimulus, would be a uterine stretch. Okay, so a baby's ready to be born. And then that uterine stretch tells the receptors, which are stretch receptors. These are going to be stretch receptors in the uterine wall, and they do what they're supposed to do, right? They alert. So the stretch is noticed by, and then the stretch receptor alerts the control center, which is the brain. Oops. And so again, in this case, it is the brain. And then the brain commands the effector, right? And the effector is a muscle, right? It actually is, this would be the uterine muscles, right? But the difference here is that the effector now keeps on contracting, so causes more So instead of less, it causes more contraction and stretch. So instead of returning to normal, we get positive encouragement of that stimulus, and you get more stretch. And then this will continue until the baby is born. And by the way, breastfeeding works the same way. So the longer the baby is suckling, the more the milk will keep coming out. So it's a similar mechanism to breastfeeding. And then I wanted to give you one other example. I'm going to make a thick line right here so you can see. I'm going to give you one more example of positive feedback, and that's going to be blood clotting. Let's see if I can do this. So the stimulus is, in this example of positive feedback, is a cut. And what we want to do is we want to make a platelet plug. It's going to start to help the clotting of the blood vessel so that it can heal, right? So it's going to be noticed first by receptors on the platelets. So the platelets have receptors on them. Okay, hold on to your horses though, because this one gets funny. Okay, then the receptors trigger the control center, which in this case is the platelet chemicals. And then those platelet chemicals command the effectors, which are other platelets, more platelets, to become activated. And so we get an end response of more and more platelets are activated, and you get this platelet plug that forms as they all stick together. And then that is going to cause a stopgap to stop the bleeding. So do you see how an activated platelets caused more activated platelets? So we could put that here. So activated platelets activate more platelets. And this is the exact opposite of negative feedback. In negative feedback, activated platelets would inhibit further activation of platelets, but then you would never get a blood clot. So it just depends on what the situation is in your body, whether you want the stimulus to end up making more of something happen or less of something happen.